And all of you joining us at remote sites, I hope you're back with us. My name is Tracy Miller, and I'm the Early Childhood Obesity Prevention Specialist for the Prevention Services Division at the State Health Department. And a good chunk of my position, about 30% of my work, is obesity prevention in WIC. So that's why I'm spending the today with you, and of course tomorrow the other sites that are joining us for regional training. I'm devoting these 2 days to spend with you all, because a lot of what we're talking about is obesity prevention and moving obesity prevention ahead in WIC. So today I'm going to see. Yes, everything's working lovely. So today's objectives are for this next hour, and my job is to keep you engaged, and I don't have all the skills that Darlene had, but I'm going to do my very best to wrap all of this up for you today in the context of obesity prevention and WIC. So I'd like, after our hour session here at the end of the day, I'd like you to be able to understand what today's approaches are for preventing obesity, and that's in all populations, not just in our early childhood population, but for all populations. And also, I'm hoping that you'll learn what matters most. We know that obesity is very complex, and intervening and prevention is very complex. And I'm hoping to bring the scope of that down a bit for you so that you know when you're going back to your agencies and clinics, you know what matters most. And some of you have heard me speak about this before, especially those of you who are wellness coordinators for WIC, or if some of you in your agencies have had me join you for presentations and whatnot. So this might be a bit of a review for some of you. And then we're going to talk about those messages. So how many of you remember, with a show of hands, how many of you remember May 31st? I think that's when it was, getting a message from me about messages in email. Does anybody remember that? Okay, good. I saw some nods, but I'm hoping you remember that, because we're going to go over the 6 obesity prevention messages that we're going to use in WIC, and I'm hoping I don't run into that wall all day. Am I pretty centered with the screen, Linda?
A little more.
I'm going to run into this wall. Okay, we're good. All right, so, and then also at the end, I'd really like to feature some of the activities of our local agency WIC wellness coordinators, and we're going to be able to have a little discussion here at Tri-County and El Paso County. You're going to stay with us during that little segment of my session, and then those of you at the other sites, you'll be able to have a discussion with your wellness coordinators at your sites as well. So that's what's on the agenda for the last hour of today. Okay, Linda, now it's not working. Next slide. Alrighty, so let's start talking about this shifting in frame, focus, and strategy for obesity prevention in all populations. So, next one. How about if I just lean down there and do that?
Middle here.
Hang on one second here. Okay, so we're going to talk a little bit about the difference between an old approach for obesity prevention and today's approaches for obesity prevention. And what you see on the screen right now is all about the old approach. And some of this you heard Nora talk about this morning around this information dumping and whatnot. So I'll talk a little bit more about that. And I've been around long enough in obesity prevention to even see this shift. I haven't been around forever, but I've been around long enough to start to see this shifting in focus and frame as we address this really difficult issue. So the old approach is technically focusing only on individual behavior change, and the notion that this problem is a result of people just not making good behaviors, right? Or not making good choices. And it's the individuals that are causing this problem. So that's kind of the old approach and the old thinking. And what it's based on is an old frame. And I heard Nora talk about this morning too, this notion of values of health. We think health is important, and so should you, because you should value health like I do. So we know that not everybody values health. We all have very different values. But this old approach is focusing only on that value. We should make these individual changes because we value health. And you should too, because I do. Does that make sense? And then we have this old strategy. So the strategies around this is telling people what to do. And Nora talked about this morning as well, that it doesn't work. And it's telling people what to do to change their individual behavior and dumping information. Me telling you what to do because I value health and you should value health. And this is all because of a result of individual behavior. So that's a little bit old, and some other examples are one-way education, some non-participant-centered goal setting, so not involving the participant in goal setting, and lectures and mass distribution of materials and information on in written material. So you all remember the days where we just have tons and tons of written material. We hand it out, it ends up in the trunk, in the back seat, in the trash, wherever, right? So that's all a part of this old approach. And what we're seeing, and what I've seen over the past 10 years, if you want to go to the next slide, is a shift to a newer way of thinking. And with it comes a new set of values, new strategies. So let's describe that. And then I'm going to describe how this is starting to look in WIC, this new approach. I'm not even on the screen, am I?
No. It's like you trying to pull it in.
Hang on 1 second, we'll get this figured out.
Yeah, I just turned it again.
Let's let it catch up.
There you go.
Is that better? There.
There we go.
Okay, so I'm standing in about the right. Is everybody okay over there? Okay. All right, so let's talk about today's approach. This is a new focus on changing environments to make healthy choices easier. So that's a little bit different than counting on individuals only to make choices, to make healthy choices. We're now starting to think of the environment as impactful in the choices that individuals make. It's not just only about individual choice, it's about the environment that we live in. And this new frame of thinking about obesity prevention and acting on obesity prevention highlights different values. If you remember, the old frame was all about health. I value health, and all of you should value health, and my clients should value health, and everybody should, because that's what we value. But really, this new frame of thinking is about some different values that are very common in our society, such as values of equity. And what I mean by that is that we should all have access to healthy foods, no matter what our zip code is. Okay? Security. We should all have enough resources to obtain healthy foods. Justice. We all have a right to have opportunities for healthy lifestyles, healthy food, and physical activity opportunities. So those frames are a little bit different. And I always hate it when the fight against tobacco gets compared to obesity prevention, because they're drastically different issues, but there is a similarity in how things have moved over the last 10 years with the anti-tobacco movement. And when that movement started to shift away from values of health to more values of we all have a right to be in a smoke-free area, that's when that work started to get some more traction. And we're seeing the same type of thing happen with obesity prevention. That when we're thinking about our environments and zip code, we all should have access to healthy foods. We all have the right to be in a healthy environment. Those are the types of values behind this new approach for obesity prevention. So what are these strategies? Oops, not yet. What are these strategies related to this new approach? Well, it's a balance of education and counseling using internal motivations like you heard today. So this is a one-on-one approach that looks different than the old information dumping, me telling you what to do. You heard a lot of it today, right? So this new strategy is a balance of education and counseling using those internal motivations and tackling some of those individual challenges and root problems that impact our ability to make good choices. So motivational interviewing, some of those techniques you heard this morning around health coaching are some of those strategies in this more today-like approach for obesity prevention. And then we also, with respect to the environment, we're doing more addressing upstream root causes in the environment in which we work, live, and play that influence our choices. So what do those strategies look like today, as opposed to just trying to change individual behavior? Those examples are things like policies and taxes and bans. So making the environment an easier place for people to make better choices. Environmental change such as better sidewalks, grocery outlets, and food deserts. And the last one there is modifications to some of our big systems that influence our choices that we make. So some of the work around food systems and And how do we encourage using local foods and local produce, those types of systems changes. So I just want to leave you with that sense of how things have changed over the past, and WIC is coming right along with it. You've heard, we started with VINA, if anybody remembers the state meeting we had, when was that? A couple years ago, or, well, maybe even 4 years ago, 3 years ago. That long ago? Okay, so VINA was the first kind of start to shift a little bit away from, that one-way education. And then today's regional training is focused on how do we take that to the next level for more of that use of internal motivation and counseling. And then, so if you want to go to the next slide. So we have these improved counseling methods. We're already seeing that in WIC as the shift has moved on. And then we're seeing in WIC a lot about improving the environment. And I'm really thrilled to see all of the nutrition education plans that came through for WIC. And a lot of that work is related to improving the environment, such as making healthy choices easier through farm-to-family programs, connections with community gardens. I know that's what you do here a lot at Tri-County, as well as physical activity opportunities. So connecting WIC participants to low-cost physical activity opportunities in the community. And then finally, community collaboration. We know that in order to change our environment, it involves all partners working together to make that happen. And this is something that I'm seeing a lot of in WIC as well. So all of you should be very proud of the shift that you're making in obesity prevention, because it's come a long way. And I hope, how many of you have seen this shift as well, along with me? Has anybody seen or recognized any of these shifts that I'm talking about in WIC? Okay, so you're living it, and we're getting there. And there's always more to do to improve. But that old way of thinking, that old obesity prevention approaches, they're out. And so I hope I've described what today's approaches are that are more in and hopefully more successful to make an impact. Okay.
Just get disconnected, but hopefully it's reconnecting shortly.
All right, so we're going to do a little bit of a quiz here. Go ahead and hit the next one. So let's get your brains working a little bit, and we're going to start talking about what matters most in obesity prevention. So here's your first question. According to the most recent research, which of the following factors is most strongly linked with obesity in early childhood? And there's 3 choices here. So all of these 3 choices are linked to obesity risk in early childhood. Which do you think is the strongest? So we have inadequate fruit and vegetable consumption. The second one is duration of sleep, and the third is excessive juice consumption. How many of you think A, inadequate fruit and vegetable consumption, is the strongest? Okay, I see no hands here today. How about B, duration of sleep? Okay. And C, excessive juice consumption? All right. Great. So, answer is, next one.
A, B, and C.
And next one again. The answer is duration of sleep. Out of those 3, this is the one that's most strongly linked to overweight and obesity in early childhood. Those other 2 are also risk factors, but this is one that's strongest out of those 3. Okay, next one. So here's the next question. Same question, just different options. According to the most recent research, which of the following factors was most strongly linked with obesity in early childhood? We have attendance in childcare, maternal body mass index before pregnancy. We talked about that today, right? Smoking during pregnancy. So how many of you think A, attendance in childcare? Okay, B, maternal BMI prior to pregnancy. Okay, C, smoking during pregnancy. Okay, so all 3 of these actually are connected in some way to overweight and obesity risk before the age of 5, but the answer is, next one. Hit it twice. Ah. Next one. It's maternal body mass index. So a lot of you got that right. Great. So this is the type of thinking, if you want to go to the next slide, this is the type of thinking that I had to go through when I started this job about almost 2 years ago. Walking into this big complex issue, I had to think to myself, what matters most in preventing obesity in early childhood? So I know where to tailor our efforts, and knowing that we can't address everything, what do we start with? So I'm hoping you can leave today with some good scope down ideas of where to focus your efforts when you have such little time and so many competing priorities during the WIC visit. So let's just start with, okay, now it's working. So let's start with the life course perspective. So many of the factors I'm going to talk to you about, some of those areas that matter most in obesity prevention, they really pertain to these 4 phases of the life course. So before pregnancy, and for many of you, it's interconception, the period in between pregnancies, because that's who you have is most captive in WIC. Or it's also our young women that will soon become mothers. And then we have the period during pregnancy, the prenatal period, and infancy, and in young children before the age of 5. So you'll see that the factors that are coming on our next slide, if you want to switch there. Oh, I can. The factors on this slide here, they're going to cross all of those areas of the life course. So when I talk about early childhood obesity prevention, and when you talk to your community members, or if this comes up working with others in your agencies, keep in mind that obesity prevention means the period between pregnancies or prior to pregnancy, during pregnancy, and 0 to 5. They all matter a whole lot. So what we did is we did a literature review about, I think it was about 3 years ago, where we took a look at what the most evidence-based factors, or the strongest factors related to overweight and obesity risk prior to age 5. And these are the factors that came up to the top. And we also had some stakeholder engagement to identify what we ought to focus on here in Colorado. So putting a whole bunch of data together, I was able to come up with some focus areas for us, and these are listed here. So the first 2, pre-pregnancy BMI and appropriate gestational weight gain. Of course, those are critically important because of genetic predisposition, that's one factor, mixed with a shared environment. So we have mom with baby, unborn child, or mom who has just given birth, or mom with a very young child. They share a common environment of lifestyle factors and exposures. And then finally, this notion of pre-metabolic programming. So metabolic programming of the infant because of the conditions during pregnancy. And some of you may have received some training on that in an intensive course we had, I think it was this last October. But that metabolic programming is a pretty strong theory that's explaining why this pre-pregnancy BMI and weight gain during pregnancy is so closely linked. These are very strong factors to overweight and obesity risk in the young child. So then we go on to infant feeding practices, and what I mean there is responsive feeding. So does anybody know what responsive feeding is? Can anybody sum it up in a sentence? No? So responsive feeding is recognizing cues of hunger and satiety. And that's what I'm talking about here. When we talk about infant feeding practices, that recognition of hunger and satiety and responding appropriate is in an appropriate way is a strong risk factor for overweight and obesity under the age of 5. So actually, I think I said that backwards. So inappropriate or failing to recognize those cues of hunger and satiety is a risk factor. So the preventive factor then is responsive feeding. Sleep duration, we've already pointed that out in the quiz, that's one of the strongest, just like pre-pregnancy BMI and gestational weight gain, very strong factors for obesity risk in the child. And screen time, that one is a toxic combination of inactivity, consumption while we're watching. We know that happens. What do we do when we're watching? We're eating. And then also the food and unhealthy advertising and marketing that children are exposed to while watching television. So screen time is it's not one of the strongest factors, but a considerable factor. Physical activity, of course, is very straightforward, and we were able to talk a lot about that today. And then breastfeeding as protective against overweight and obesity risk in the child. And then finally, nutrition is a critical part of the equation. However, the evidence doesn't fully outline which of those parts of nutrition are most closely linked. There's nothing that really stands out above all others. some evidence around sugar-sweetened beverages, but certainly not one of the strongest out of all these factors. But we do include nutrition as a focus area because it's a critical component to all of this. So as you look at this list, where do these factors intersect with my work? How many of you think about half of them intersect with your work? Hands? How many of you think all of them intersect with your work? Yes, all is correct, and that is what's so unique about WIC. So in my work, I have an opportunity to work with many, many partners that are working to prevent obesity in early childhood, and WIC is really the only partner, the only program, or the only program and partner. All of you are partners to the state agency in all this work, that truly is able to address all of these factors in your work, and that's very unique. Really no other program or partner has the opportunity to reach, impact all of these factors. So there's definitely a huge role for all of us here, which is why we're putting so much emphasis on healthy eating and active living in this regional training, because you all have such a critical role in that. So let's move on to messaging. We had a start of messaging this morning. Does everybody remember, with some nods please, hearing Nora talk about how to incorporate WIC, ECOP messaging into the counseling process and those techniques that she taught you? Does everybody remember that this morning? Okay, so she and I purposely worked together to be sure that we gave some really solid examples around messaging. But let me talk a little bit about this messaging project before we move on to talking about the messages individually. So this project has been going on for well over a year. It's taken a really long time. And WIC has been involved, local agency and state agency staff have been involved every step of the way in every phase. And it's had many phases. So I think I described a lot of those phases to you when I sent out the email at the end of May with announcing these first 6 messages that we're rolling out in WIC. So just briefly, we created the messages, we borrowed some messages, and then we tested them in focus groups throughout the state. And many of those focus group participants were WIC clients. So our participants have a really strong voice in how these messages were revised for use in WIC and statewide. So WIC is not the only program using these messages. This is going to be a statewide dissemination here in a couple of weeks, as a matter of fact. We're holding a webinar for all other partners, and you all can attend as well if you wish, but I'm pretty much sharing everything today that I'm going to be sharing on that webinar. And these messages are reaching healthcare providers, they're reaching other public health programs, your partners in Nurse Family Partnership and Prenatal Plus and other direct service programs, and child care providers and child care professionals in the child care system. So the intent is that families can hear the same messages wherever they spend time in their communities. We have 4 or more local public health agencies receiving maternal and child health dollars, rolling out these messages at the community level with their local partners as well. So this is an effort that is involving many, many partners to achieve consistent messaging throughout the state. And I'm happy to say that all of you are, and WIC is receiving the most support in how to actually use these messages out of any other partner. So we are doing a publication for all the rest of the partners in the state and a webinar, but today you had an opportunity with Nora this morning to actually learn how to use these messages in your practice. So I think that you're ready to go. And once we get done talking about these messages, I think you're going to be able to start putting them into practice once you start working them into your schedules and making it come to life. So let's talk about these messages. There's 6 of them that we've rolled out this year. There's actually 9 messages total that we're rolling out in September. But in WIC this year, we just decided to start with 6 messages, and then the other 3 can be rolled out next year. And that way we can just focus on these 6 and then just not overdo ourselves, if you will. Okay, so next one. Oops, no, I don't have mine. Okay. So the first message is healthy eating and staying active while you're pregnant matters for you and your baby's health. I think Nora talked a little bit about this one this morning. And what we found from our focus groups was that this is a good message and it's effective. And they suggested additional information to support the message in a positive manner, focusing on what to do rather than what not to do, and describing the good results for mom and baby. So I'd also like to put, before I get too much further, each of you should have a document in your folders that have all of the 6 messages on them, and that way you don't have to squint here, but I will be zooming in. Now it's not working. I will be zooming in on the supporting points. Just make sure you have that with you. So each of these messages has a main message, which is the top message that you see, and then there's supporting points that support that message. So in the supporting messages, we added, based on the focus group recommendation, information around why gaining just the right amount of weight during pregnancy is important. Across all the messages, most of our focus groups really wanted to know why. They wanted to know why this was important and why they should do this. And we also added, for this particular message, some tips to demonstrate what we mean by a healthy diet and what we mean by staying active. And we also had to put the disclaimer in there to talk with a healthcare provider before beginning any sort of physical activity plan. So one thing that was difficult in making creating these supporting points for these messages is that there's a long list of things that could go in the supporting point. But to keep it something that's contained and just gives the participant or the target audience an idea of what we mean by some of our concepts is what we went after, so that we didn't end up with a book of supporting points for each message. So we tried to address the recommendations of the focus group by adding some of these pieces for this message. So the next message is give yourself and your baby all the benefits of breastfeeding. And this message is actually a message to promote exclusive breastfeeding. If you look at the under doctors recommend, if you look at the bullets there, that describes that it's really an exclusive breastfeeding message. So the points, and that's part of the main message, by the way, as well. So for the first 6 months, feed your baby only breast milk, even if it's offered by a bottle, and aim to continue breastfeeding while offering solid foods until your baby's at least 1 year old or older. So the focus groups for this message, they really had an agreement with the intent of the message to promote breastfeeding. They recommended that we reduce possible feelings of guilt. So there was an original message that was modified for this breastfeeding message, and eliminate any confusion. There's some confusion around the length of time women should breastfeed, and a description of the benefits of exclusive breastfeeding. They wanted to know why. What were those benefits? So we certainly added all of those recommendations in the supporting points for this message. So this is one that Nora talked about this morning. Does everybody remember this parent power message? This is one of our consistent messages that we're rolling out for the state. There's no power like parent power. Eat well and move more to care for yourself and your family. And just a note, the original version of this message referred only to mom power. So it was only tested in the focus groups of mothers. And most of those mothers felt like the message is concise and empowering, which is what we really were talking about this morning, is empowering and building confidence. They recommended the addition of the benefits of taking care of yourself in the supporting content and suggestions and tips of how to do this. So what does it look like to take care of myself, to give an example of what that means. Mom power was changed to parent power due to discussions in the message revision group, which contained about maybe 20 stakeholders that thought that we really needed to include dad in the mix, or whoever else made up the family and the caretakers. But do know that if you're doing something with just moms, if you have some sort of mothers group, or you feel like it's more appropriate to use mom power, you're welcome to do so. We just wanted to be able to be inclusive of who caretakers are in this message. But really, it's originally an interconception health message for mom. So feel free to change that parent to mom if it's something that's appropriate for what you're doing. So in the supporting points, we included why this is important to take care of yourself so that you can care for others, and some sort of a statement to give an idea of what taking care of yourself means. It certainly isn't everything in the list that we'd want to say, but it gives an idea of what that means. So the fourth message, this one's going to ring home to you here at Tri-County and perhaps to other WIC agencies in Colorado. We knew that Rethink Your Drink was a message that was being already in use in WIC. And so therefore we did not, and we knew that we needed a message around sugar-sweetened beverages. So we thought we would test these messages because they hadn't been tested yet in Colorado and roll those out as part of our ECOP messages. So this message really tested fairly well. Folks thought that it was simple and to the point. And they recommended the addition of suggestions to make water more tasty and some instruction of how much water should be consumed daily, which was tough to do in one sentence because it does vary by size and activity level. So we were able to accommodate that in the supporting points to talk a little bit about what the benefits of water are and how to make it more tasty. So this is one that I'm really glad we're able to roll out to be consistent with your efforts here in WIC, at Tri-County, and at other local agencies using this message. So the fifth message is all about responsive feeding, and I described that earlier around recognizing cues of hunger and satiety. So trust your baby to know how much he needs to eat. Your baby will show you signs of hunger and fullness and will trust you to respond. So it's something about trust, and we're hoping to tap into the value systems of moms that all moms want their babies to trust them. All moms want to trust their babies. It's something that trust is an important value that many of us have. And this message actually did test very well. They felt it was effective and an important reminder. They agreed that it's clearly for parents and caregivers of infants. So this message is targeted towards caregivers of infants. And certainly we know that this concept is still valid for preschool-age children. It's called the division of responsibility, right? So letting children choose if and how much to eat, and adults have the responsibility to choose what's on the table and when we'll eat. So the concept is definitely goes into the age group of older children, but the message itself is about infants and targeted towards caregivers of infants. So the supporting points include some of those descriptions. Well, what does a sign of hunger and satiety mean? And we tried to be very brief in the supporting points to show what some of those signs are. And this can stimulate a conversation around some of these other signs that babies give moms and what those signs mean. So crying is a late sign of hunger, right? It's a late sign of hunger. But crying doesn't always mean that baby's hungry. So there's lots of other reasons. Baby's tired, baby needs to do something different, baby's got a wet diaper. So this is a conversation to help mom understand baby. But we're definitely using it from the standpoint of how do we know when baby is hungry and full. So the last of the 6 messages is a broad message around nutrition and physical activity. Give your child nutritious food and active play for a healthy future. And this message was really interesting in the focus group because the original message was quite different. It read like this. It read, give your child or grandchild gifts for a bright future. Healthy foods and active play. It talked about gifts and bright future, which was kind of different than what we ended up with, and I'll tell you why. So the original message the first impressions were pretty positive among grandparents and mothers, but among fathers, it generated mixed impressions. They really didn't believe that, they suggested, actually both mothers and fathers suggested that we move healthy foods, those words to the beginning, and de-emphasize the word gifts. And then also they agreed that fathers particularly agreed that good nutrition cannot guarantee a bright future. So we made sure that we weren't putting any false guarantees into the message and rearranged the wording in such a way. So what we've included in the supporting points for this message is offering, what it means to give your child nutritious food and active play, some examples. Of course, it's not the full nutrition book and materials that we would give, but some examples of what those types of things are. So wrapping up messages in counseling, and this, I just wanted to wrap back around to some of the things that Nora talked about this morning. I think that she left you some really good ideas of ways to bring in messaging while you're using appreciative inquiries techniques, and motivational interviewing. So the idea here is that we want to plant these messages in fertile ground. You heard Nora talk a lot about when moms can hear things, when they'll listen, those types of, when she feels confident. That is fertile ground. So through appreciative inquiry and affirmation, you're creating fertile ground in which you can infuse these messages. And helping participants remember those present or past successes can help them take action on your message. So this is just a reminder of what you learned this morning, and keep the two connected. Messaging and these techniques that you learned go hand in hand and shouldn't go without each other. And even if it's a concept that isn't one of the 6 messages, you still can think of what is your message if it's not one of these. What is your message on a particular concept, and how does that wrap into the process of appreciative inquiry and motivational interviewing? So I'm hoping, again, I mentioned that you all are getting the most support out of any program here in Colorado on how to actually use these messages. So give it a try and practice it and build them into those counseling processes. I'd also like to mention that Linda and I are going to be starting to work on materials to accompany these 6 messages. And it most likely will not be the typical old handout, information dumping, but some creative materials that might be useful in solidifying this message as you bring it through your appreciative inquiry processes. So be looking for that. It's going to take a while. Message or materials development isn't something that can be done overnight, but certainly we'll be involving our local agency representatives to help with that and help us think through that. So there's more to come with these 6 messages, and I'm hoping they can become part of your everyday practice. So I just wanted to double check to see if there's any questions online or here in the room that you have for me about this messaging project and what this means for WIC. All right, I hope that gives you some good foundation to what's behind these messages. And if any of you are interested, there is a research report that was written by a contractor who did the focus groups. So if you're interested in seeing more details about it, I just gave you a quick glimpse today. You're welcome to look at that. It is posted on our I don't know if it's, we're going to put it on the website. Let's make a note of that. We'll put it on the website with the conference materials. Okay? All right, so the last segment of this hour, we're doing well with time, just a little bit ahead of schedule, is all about the Colorado WIC Wellness Coordinator System. So we have 10 agencies in Colorado who have a WIC Wellness Coordinator that have been working with me over the last, since April, joining me for calls, and we've been talking about some of these factors, particularly sleep is one that we've spent time on, sharing ideas. I provided some training to the wellness coordinators. We've been working together as a potential communication system or method of moving obesity prevention ahead in WIC. So I'd like to describe this system for you just so that you've got some context of what this is about. And then we're going to hear from our local WIC wellness coordinators. So the system is a system of learning and collaboration among state and local WIC staff that's focused on wellness and early childhood obesity prevention. And we hope to achieve some specific objectives in this system that is in pilot right now. We're piloting the system this year. We have 10 volunteer agencies and I think almost 16 wellness coordinators that are part of it. So we're hoping to meet some of these objectives. We've already met in these 10 agencies this first objective where there's a local agency subject matter expert and advocate. So these wellness coordinators are working with me to increase their subject matter expertise in early childhood obesity prevention and wellness and advocate for that. we're hoping that this system will be an avenue of training for early childhood obesity prevention topics and wellness topics for local agency WIC staff, and also for this an avenue of coordinating activities for WIC participants at the local agency as well. Communication and decision making, our local WIC wellness coordinators will be part of any decision making pertinent to these topics that could get rolled out of the state office, so it's a great way to get input and contributions from local agency staff when we're creating policies that will be rolled out for the entire state. Policies or procedures or practices, it's any of those three. And then finally, we're hoping to strengthen some of our state and local partnerships that enhance obesity prevention and wellness efforts. And if you remember me talking about the new way and new approach of obesity prevention, partnerships to create environmental change to make healthy choices easier are really dependent on these state and local partnerships, and WIC is a critical part of that. So we're hoping to strengthen that at the state and local level through this system as well. So here's a list of all of our WIC wellness coordinators. You can kind of take a look at that. And I just wanted to say thank you to the coordinators. So far, it's been a great experience. I think there's been a lot of great ideas shared, and we're starting to learn what a system like this could look like. So for all of you in remote sites and here in the room that are wellness coordinators, and all of your administrators for allowing you to participate, I thank you, and we'll see what this year brings. So what I'd like to do now is get my notes here. I want to hear from the wellness coordinator. So we're going to take about 10 minutes. Here in this room, we'll take about 10 minutes, and we'll have the Tri-County Health Department wellness coordinators come on up here. Those of you that feel comfortable, don't feel forced to do this. And I know at Jefferson County that you all have a wellness coordinator who's going to be sharing her activities and what life is like as a wellness coordinator with your group. And then also in San Juan Basin Health Department in Durango, you're also going to have your own discussion. So at Jeffco and in Durango, if you want to just turn the volume down, you all can have your own little discussion. And El Paso and Colorado Springs, if you'd like to just stay with us and hear from our wellness coordinators, you're welcome to do that. And this is just going to be a very brief 10-minute discussion. You can ask the wellness coordinators questions if you like. And so let's begin. If all the wellness coordinators from Tri-County would like to come up, I'd like to introduce Amy Armstrong. She agreed to start this off for me. So here you go.
And it's really great. It's fun. It doesn't take a lot of time. A few conference calls here and there. And like I said, just working within your agency.
Ask your question. So, Amy, can you describe a couple of the specific activities that you've been involved in, and if any of you who are wellness coordinators have anything you'd like to add, feel free.
Okay, so for Tri-County so far, we just attended the conference calls, and then we decided as a group that we were going to focus on sleep. So that has been our key focus message. We're still playing with it. I mean, I think it's important that we talk about it more. But to start off with, it was brought at each office, just discuss and decide how we were going to implement it. So I think some people are using it into counseling, some people are using it into group appointments, and then we've had some of our staff create handouts or table tents in order to promote the message.
Great. Anybody else? Round of applause for all of you. I'd also just like to comment on, and thank you, Amy, very much. So the last wellness coordinator call we had, I was really energized to hear about the perception from the staff's perception from the family. So what I'm trying to say here is that the staff who mentioned that they're building this into the counseling and starting to ask a little bit about sleep, my understanding is that they feel that it's something that families are interested in talking about. It's not something, Nora talked earlier about this, how do we talk about weight in these growth charts? That's a tougher topic to talk about than sleep, and sleep is so critical, but it seems like there's just a positive energy around talking about sleep. and not only from the participant, not only from the WIC staff's perspective, but WIC staff themselves are thinking about their own sleep, which is fantastic. I heard that a lot too in the last call. So, it's really crossing all of those domains, and educating participants, but taking care of self as well. So I think that that's been really, really great to hear. There's many activities that are going on through our wellness coordinator system, and I'm just going to name a few here that Amy didn't mention. Let's see here. So starting a walking group, there's one of the wellness coordinators logged that. So the wellness coordinators keep kind of a log of the activities that they do. So there's some staff wellness activities going on. Also, there's some consistent messaging going on around the sleep topic in the community. So working with partners around, hey, we and WIC are starting to talk about sleep. What can you do in your program? Or just making other programs in the agencies more aware for that consistent messaging. And I'd also like to mention that I mentioned there's 9 messages total that we're rolling out in Colorado. We're starting with 6 here in WIC. But among the other 3, one of those is a sleep message, and it's all around TV in the bedroom. So Amy talked about the sleep message, and that's kind of the message that we were talking about when we were addressing sleep in our wellness coordinators' calls. And did anyone see the sleep article in the Colorado WIC News? So that was just another segue where we were trying to take what the wellness coordinators were doing, the ideas they brought forward, and we put them out in the Colorado WIC News so that all of local agencies could see it, whether they had a wellness coordinator or not. So I really feel like this wellness coordinator group is going to be able to impact all of you, and provide good information for all of you. And in that article, you can see some of the specific examples and resources that the WIC wellness coordinators have come up with regard to sleep. So we've only had 3 calls. The first one was an orientation call, but in the other 2 calls, I feel like there's been a lot of progress among the WIC wellness coordinators. And I just want to say thank you. And so what we're going to do right now is I'm thinking, how long have we been doing this little segment here?
About 8 minutes.
Okay. So let's just take a 2-minute breather, then I'm going to come back and do a closing for today. We're ending just a little bit early. I want to be sure the others at the other sites have enough time to talk about the wellness coordinators. Are there any questions about the wellness coordinator system or for our wellness coordinators in the room? Okay, so I'll be reporting out, at the end of this pilot how well this project has gone, and we'll determine the next steps for the wellness coordinator system at that time. So take a couple-minute breather, and don't leave the room, of course, but I'll be closing here in just a moment while we wait for the others to join us again. All right, if I could have your attention for a very brief closing as we end the day today, and I hope all of you that are joining us remotely are back. So I've got a few notes here of things I need to mention, and it is on my phone. I'm not playing games or texting. I'm just reading an email that has some closing information for you to leave with today. So on behalf of Colorado WIC, we sincerely hope that you found today's training fresh and inspiring. Can I get some snaps if you like today's training? Okay, great. And are inspired. Thank you very much for your active participation. All of you are very engaged, and really that enhances the learning of each of you to learn from each other, and it keeps the presenters excited so that they can keep you engaged. It's all just benefits everyone for engagement. So now that you all have some practicing that you can do to implement some of the tools that were provided today. And in the next month, a note about the nutrition unit, we will be exploring ways to incorporate this information into the core activities, including new employee training, participant pamphlets. Linda and I talked a little bit about messaging and messaging materials, those types of things. So if you want to view or print any of the materials in the packet, they're all posted on the Colorado WIC website, and there's a particular section there about this regional training where all those pieces are posted. And finally, please go online to fill out the evaluation survey. You can zap the QR code with your smartphone or wait for Linda Doolin's email, Linda. containing a link to the survey. And I wish you very safe travels home. And again, thank you for being here and for being attentive and happy and fun. And I sure enjoyed watching all of you have fun. So have a great day, and thank you again.